and chemists are saying that they may need to start charging for services that are currently provided for free in response to the challenges posed by 60-day dispensing changes. Let's bring in Anthony Soni from the Pharmacy Guild now. Anthony, really appreciate your time. Thank you. What sort of services are we talking about here?
Thanks for having me on the show. First and foremost, we want to say that pharmacists and pharmacies across Australia support cheaper medicines, but it's the way we go about it. And with 60-day dispensing, as it stands, for want of a better way of explaining it, it's the government shouting the bar but wants the bar to pay for it, being the pharmacy supplying a second box at their cost to a patient instead of one box at a time. And the types of free services that have been typically funded from dispensing income in pharmacies have been things like blood pressure checks and home deliveries, particularly for older patients in the community and also patients living in residential aged care. And what pharmacies are having to look at now is, because their dispensing income is having a significant hit from this policy from the government, north of $3.5 billion over the next 4 years, they're forced to review everything and look at charging for services they typically did for nothing. And we really don't want to do this, but we're kind of forced to because of these rushed and poorly consulted government changes directly impacting dispensary income that we use to provide services to the public that have come to rely on them from their local pharmacy.
I assume pharmacies have done a bit of modelling around this. What sort of prices are we talking about? So if someone wanted to go in for a blood pressure check, for example, how much could that cost them?
I can speak from my pharmacy's perspective that we will be unfortunately introducing a charge from the 1st of September of $5 for a blood pressure check in the pharmacy and $5 for a home delivery for patients in the community. We did these at no charge up until now because it was funded from our dispensing income. And it's kind of perverse, really, that the people we typically deliver to, home deliveries with medicines, they're older patients, they're more vulnerable, they take quite a few medicines, and they reach their safety net, which is a certain number of prescriptions over the calendar year, and they reach a threshold and then no longer have to pay anything further for the remainder of the calendar year. So they're not actually going to save money from 60-day dispensing in terms of out-of-pocket costs, but these people are actually going to have to pay more for their services from their local pharmacy because the pharmacy's being forced to look at their services and charge for things they did at no cost before. So there are a range of different prices that pharmacies are looking at charging. I can speak from my own pharmacy's perspective. Unfortunately, that is going to be commencing from the 1st of September. But Commonwealth Bank, in a survey of 360 pharmacists in their Pharmacy Insights report, did find that around 80% of those surveyed are looking to charge for services that they haven't done in the past. Over 60% surveyed were looking to reduce their staffing of pharmacy assistants, who are mostly women and working part-time. And about 50% of those surveyed were looking to reduce their trading hours. So this is not good news for patients. We want cheaper medicines. It's a good thing for healthcare, but it's got to be done the right way. And that's why we're asking the government to not rush this policy. We should be pausing, sitting down, consulting and working out a new funding agreement for pharmacies so we can deliver the care that the public expect and deserve from us. So we're halfway through a 7th community pharmacy agreement that's due to end in 2025. We've had such a big change. It's just really moved the goalposts in a big way, and it's forcing these cuts and changes in terms of what pharmacies now need to charge patients because of the cuts to their dispensing income that was part of a 5-yearly agreement we thought we had.
I see that charging new mothers every time they go in to weigh their newborn in the pharmacy on the scales is also one of the services that people are looking at charging for now. Wouldn't the pharmacies be biting off their noses to spite their faces, though, doing that sort of thing? I mean, for you, for example, charging for a blood pressure check, as I understand it, the reduction in foot traffic thanks to the 60-day dispensing issue is going to be a problem for pharmacies. If people don't pop in for a regular blood pressure check or don't pop in to weigh their newborn as regularly as they might if they're going to get charged, won't that just exacerbate the issue for you? Don't you find that when people pop in for those checks, they might pick up some medicine or some other items while they're there?
There is certainly that risk, absolutely. But pharmacies are the most visited and accessible primary healthcare destination in Australia. People trust their local pharmacist and they value the care they get from their pharmacy and are open for us to do more in terms of healthcare delivery. And we saw that through the COVID pandemic with COVID vaccinations, over 10 million doses delivered nationally from pharmacies. But as small business owners, we need to make ends meet. We have obligations to our landlords, to our banks, if there's a loan facility that we need to service. And these are the realities of what we're dealing with. And all we're asking the government to do is to listen and to consult more with us. And we need a new funding agreement that helps address these issues, because these services have been funded typically from our dispensing income. We're halfway through our 7th community pharmacy agreement, and things have been changed in a massive way really quickly without consultation. So we need to sit down with the government, work out a new 8th community pharmacy agreement so that we don't have these unintended negative consequences for patients. Cheaper medicines are a good thing, but we need to do it the right way, because some may benefit, but many won't.
Okay, Anthony, appreciate you bringing that to our attention. Thanks so much.
Thank you.